Welcome. Thank you so much for accessing the education modules associated with the State of Michigan Pediatric Care Coordination Center, which we often refer to as the PCCC. My name is Samantha Mishra. I am the EMS for Children Coordinator with the State of Michigan, housed in the Bureau of EMS Trauma and Preparedness. I am so thankful for the opportunity to participate in the development of a Pediatric Care Coordination Center for the State of Michigan. The vision of the Pediatric Care Coordination Center has been collaborative from the very start. With the full support of numerous pediatric leaders from across the state of Michigan, along with MDHHS BETP staff, the original goals and missions have driven the formation of a coordinated and organized system available to assist all regions with pediatric disaster and emergency situations. The PCCC is designed to augment and support regional disaster mitigation and response plans should they become overwhelmed during a pediatric emergency or disaster.
Thank you, everyone, for joining in today to watch the presentation about the Michigan Pediatric Coordination Center. This is a concept that, together with partners around the state, we have brought together an idea about how we can improve the care of children in the, God forbid, situation in which there was a catastrophic disaster in the state of Michigan. My name is Dr. Ron Ruffing, and I am the Chief of Pediatric Emergency Medicine at the Children's Hospital of Michigan in Detroit. I want to also thank and share with you my colleagues. That's Dr. Matt Dennenberg from DeVos and the Spectrum Health System in Grand Rapids, and Dr. Stu Braden and Dr. Marie Lazan. Both of them are from Ann Arbor and the Mott Children's Hospital with the University of Michigan system. The Pediatric Care Coordination Center is a concept that together we have devised to think about how we could better provide care for children in a disaster. In Michigan, we have 3 major centers that provide pediatric tertiary level care. We also have a number of other sites around the state that provide this care. If there were a catastrophic event, how could we all work together to provide the best care for children in the state? That will require coordination, partnerships, understanding of resources, moving the right patient to the right place at the right time. And this really is the idea of the Pediatric Care Coordination Center, a single entity that would provide the coordination of all the different sites across the state, matching their needs and their resources together to provide the optimum care for children in a disaster. I've identified some of the common vulnerabilities in the state of Michigan. We have natural disasters. We've seen floods, tornadoes. Winter storms have proved to be a big problem. So these are regular occurring events that we have to think about and prepare for in Michigan. We also have the risk of man-made disasters. These would include things like power failures, terrorist events, nuclear explosions, chemical, biological weapons, also political disruptions. So these are the situations, the vulnerabilities that we have in Michigan that we have to think about as we plan our resources around caring for children, what type of events might trigger a catastrophic disaster. In Michigan, there are 3 what we would refer to as tertiary pediatric children's hospitals. There's the Children's Hospital of Michigan in Detroit, there's Mott Children's Hospital in Ann Arbor, and there's DeVos Children's Hospital in Grand Rapids. These are all tertiary level care. They all have ECMO capacity. They're trauma centers. These are the leading educational and research institutions in the state. But we also have other assets that we can draw upon in a situation of a disaster. These are more local pediatric centers, also have the ability to provide trauma care. These centers are in Lansing at the Sparrow Hospital, at Beaumont Children's Hospital in Royal Oak, at the St. John's Hospital in Detroit, at Hurley Medical Center in Flint, at Bronson Children's Hospital in Kalamazoo, and at the Covenant Health System in Saginaw. So these are the players in Michigan. These are our partners who we all need to work together in a catastrophic situation in which multiple large numbers of children were injured or ill. The Michigan Pediatric Care Coordination Center will be operational throughout the disaster cycle. We envision, or we have suggested, that we may play a role in hazard assessment, needs assessment, investigations about resource capacity and capabilities. The center would also provide logistical support by establishing and opening channels of communication, developing increased situational awareness by sharing information across multiple sites. We could address issues about supply and resource allocation to the appropriate site given a specific site's need. We can also think about how to move patients from one site to another by working with EMS resources. In a catastrophic event, we can assist with triage, making sure that patients move to appropriate sites. We can provide telehealth consultations with specialty experts. We can help organize critical care transport services and provide just-in-time training to sites for those situations in which they may have to shelter in place. So what I've been introducing you today to is our idea of how a Michigan Pediatric Care Coordination Center might serve the people of the state of Michigan. But what we're really about today is putting this idea out to you and looking for feedback about how you envision a Michigan Pediatric Care Coordination Center. What services might it provide for you? What services do you need? What resources do you have? What vulnerabilities do you have for caring for a large group of pediatric patients? And how we might better work together to develop this concept in Michigan. So I want to thank all of you for taking the time to participate in this exercise today. We are really looking for honest input. Remember that we're in a proposal phase. We need your feedback in order to create a coordination center that is valuable to all of the citizens and families in Michigan. We have lots of different partners, lots of different places, lots of different needs, lots of different vulnerabilities, and we want to be matching up these resources. But we need to hear from you about how you envision this coordination activity taking place at the Michigan Pediatric Care Coordination Center.
Hi, I'm Amber Pitts, the Healthcare Preparedness Program Manager for the state of Michigan. I'm here to talk to you a little bit about the communication pathway for the Pediatric Care Coordination Center, or otherwise known as the PCCC. When there's an incident that may require assistance, early communication with the Regional Medical Coordination Center, or MCC, is imperative. Once the MCC is contacted, many phone calls will be made on your behalf to entities such as the MDHHS Community Health Emergency Coordination Center, otherwise known as the CHEC, local and/or district emergency management, and other agencies that will benefit from the situation awareness. Once the CHEC has been notified, they will contact the PCCC and advise on the situation. Working with their resources, the PCCC staff will reach out to the affected facility using the information collected on the EEI form, Essential Elements of Information. Constant communication between the affected facility, the Regional Medical Coordination Center, and the PCCC will be critical to help address the needs of the affected facility.
Hi, my name is Lauren Cordy, and I'm the Medical Surge Planner for the Bureau of EMS Trauma and Preparedness here at MDHHS. The Elements of Essential Information, or EEI, is a vital part of any response. The document guides both the caller and staff to obtain baseline information that will be used to make decisions from various response agencies. The EEI for the Pediatric Care Coordination Center was developed to identify specific information needed to gain situational awareness and allow for critical services to be deployed quickly. When looking at the document, you will notice that the form asks very specific questions. Because of this, it is imperative that the person who calls the Regional Medical Coordination Center have full situational awareness, such as the incident commander. Halfway down the document, you will see the form asks for the number of casualties, intubated patients, types of injuries, as well as decontamination situations. This information is critical to collect accurately, as it will drive the services sent to the affected facilities. This plan has been developed with the idea that this form, once completed, will be sent to the RMCC by email, then sent on to the check. From there, this document will be shown to key stakeholders in the state in order to help facilitate a response. Please remember that although the information on this form will be kept private, patient identifiers should not be documented here.
Thank you, not only for your interest in learning about the PCCC concept, but also for your participation and engagement in the workshops to follow. Your feedback will be incorporated into the revision and improvements of the PCCC model for the state of Michigan. Thank you for your time, your participation, and your feedback. Now we'll turn it over to those facilitating the regionally focused workshops.